All right, good afternoon, everyone, and welcome to today's Unwrapped conversation on maternal health disparities amongst Black and women of color, and how poverty impacts the lives of new and expecting moms. My name is Allison Cobb, and I am the Director of Community Engagement here at the United Way of the Greater Triangle. I am a part of the awesome Community Impact team that leads the curating of conversations such as this one today. And this work is important to us because we're passionate about United Way's mission to eradicate poverty and increase social mobility. A mission is what really drives not only this work, but the reason that we are here today. This week, as a part of MLK and Dr. Martin Luther King Day and our week of service, we decided to recognize the impact that poverty has on lives of mothers and families here in the Triangle. Folks across the Triangle have had the opportunity to participate in our Maternal Health Challenge, a virtual self-guided awareness building experience that really aims to educate folks in the community about the issues plaguing many of our neighborhoods and how we can help. But today we are going to talk about and hear from folks who are deeply connected to this work. As a proud auntie, this conversation is a personal one to me. I have had the distinct pleasure and courtesy of my sister to watch life come into this world. And if you've not experienced that ever, it is something that you don't take lightly. I think it is a transformative experience just to watch. So I can only imagine to be birthing a human is one totally in itself. For 9 months, I watched my sister, Christy, grow a human and attempt to nurture and advocate for herself and her unborn baby, and within our own current healthcare system. From paying attention to her nutrition and being mindful of her activity, and just enjoying the beauty that is pregnancy, right? It was truly beautiful to witness. I also learned how arduous the task can be to find the right birthing options for you and your baby, to find the right team for you as you go through this transformative experience, particularly as a Black woman. As a family, we recognized our own privilege in many ways, as my sister was able to deliver my beautiful niece, Drew Amina, at one of the top birthing centers here in the Triangle. And during a pandemic, I might add, right? I also recognize that, unfortunately, this privilege of choice is not everyone's experience. In the United States, nearly 4 million women give birth each year. And the majority do so without any complications. But even with the health advances in the United States, our country still has the highest maternal death rate compared to any other developed nation. According to Blue Cross Blue Shield of North Carolina has the highest infant mortality rate in the country at a rate of 7.2 per 1,000 births every year. Think about that. For every 1,000 women who gives birth to a baby, 7 of them don't see the life expectancy as they probably went into that to experience through their child. According to the CDC, 60% of maternal deaths are preventable, right? So if we think about those two statistics hand in hand, and we live in one of the top developing nations in this world, why do these things exist? And if we narrow it down more specifically, what is going on in the state of North Carolina, right? And while these statistics are great, I think more important, we need to begin to understand, right? And we need to begin to bring about change to first accept, right, that these lived experiences of women are real. We have to believe that these disparities exist first. It's not enough just to read the statistics, right? You've got to really sit with that. That means that for every woman that you encounter who either experiences pregnancy or gives birth, at least one of them potentially may have some sort of negative experience. And so today I have the distinct honor of being joined by 3 fantastic leaders who are leading the charge to really end maternal health disparities plaguing our community locally, and advocating across our community, our state, and even our nation to see to it that all women have access to equitable healthcare. Please join me in welcoming today's panelists. We have Joy Spencer, Executive Director of Equity Before Birth, Maya Jackson, Executive Director of MAAME Inc., and Michelle Old, Executive Director of Diaper Bank of NC. Ladies, we are so lucky to have you here with us today. So let's jump right in. Joy, I'm going to turn to you first. Talk to us about your work at Equity Before Birth and how you divinely became a part of leading the work at your organization.
Sure. Thank you, Allison, for this opportunity and United Way. So at Equity Before Birth, we are committed to helping families get the pregnancy and recovery experience that they want. So surrounding them with the support, education, and care that they dream of to get through this journey. And the way that we support increasing that access is by eliminating financial barriers to receiving the care or the education support that is ideal. And so it's very important, and that's why we love what United Way does, commitment to eliminating poverty. We know the links between what financial security can do for your well-being, for your physical, mental, and emotional health. And so we are here to stand in that gap. We do this by helping families in three ways. One, working families that do not have full paid maternity leave benefits. So you are losing income every hour that you are out due to a doctor's appointment or pregnancy related event. We supplement the income that is being lost due to not having those paid leave benefits. Secondly, the second way we increase access to services by eliminating the financial barriers that may exist to receiving care and education. So if there's a childbirth education class that you would like, or a doula, or lactation and breastfeeding support, and if cost is a barrier, we will cover the cost of that service. We are committed to eliminating disparities, and because Black and Indigenous women bear the brunt of racism and other things that cause disparities, we focus on serving that population. So to that end, we connect our families with BIPOC birth workers so that the service is fulfilled by someone who mirrors and affirms and shares their cultural values. Lastly, we give direct cash assistance for essential baby items like the crib, the diapers, the car seat, prenatal vitamins, things that we know are needed for optimal development and for infants to thrive. And I know that is a lot, but that is what we do. We are committed to promoting financial security and stability and eliminating financial barriers that may exist to accessing care so that we can start to improve maternal health experiences and ultimately maternal health outcomes. This is so important to me. I wish Equity Before Birth was in existence when I was having my baby girl. I was going through a high-risk pregnancy and I was really, really sick, and I couldn't continue doing the same work that I was doing. And so I found myself pregnant, jobless, no benefits, no health insurance, no support, no partner, no family. And so it's like, what do you do? It was a really tough time. It was a whirlwind of a time, but I made it. And what we are here to do is stand in that gap, especially everyone needs additional support when you're bringing a new life into the world, but especially those who may feel that they just don't have access to the additional support that they need. We want to stand in that gap, create that access. We don't provide direct service, but we cover the cost of it. So it's critically important that we partner with multiple folks in the community to get those services to families. So we partner with any and everyone that can help us meet the need. I was just speaking with someone this morning that expressed how important it was for them being a newer North Carolina resident to find a resource and to be able to visit a website and look at all the other resources that we have in the area and just be able to navigate through a community that they were not familiar with, but that they were able to learn the wealth of resources that exist and able to feel that they were not alone and able to get the level of support that they needed to make it through, right? Their pregnancy, birth, and delivery. So I really, again, appreciate this opportunity. I appreciate everyone who has supported us thus far. We're a pretty new organization, but folks are seeing the importance of creating this financial stability. And so very grateful to be here and very grateful to add to this important topic of conversation.
Yes, thank you for that, Joy. And I think, you said so many poignant things, but what really stood out to me was when you talked about two things specifically: the importance of women going through a birthing experience, being able to see other people around them who resemble them in their communities, right? And how that really helps for folks to begin to feel comfortable about their birthing experience, begin to feel that there is someone who can advocate for them on their behalf, and really feel connected to community, right? I think giving birth can be such an isolating experience, and especially during a pandemic. And you shared so many different layers and situations in which people can feel alone, right? So as a community, it is our responsibility that we step in and we see to it that people have access to other people and they have access to resources to alleviate those barriers. I think the model of equity before birth really speaks to how you can fill in those gaps and alleviate barriers and create experiences that allow for mothers, specifically Black mothers and Indigenous mothers, to thrive. I want to pose a question to the entire panel. In your experiences in your respective organizations and in your own lives, how has poverty or the lack of resources, rather, in underserved communities impact the health of birthing mothers, right? When we think about pregnancy, you're bringing in a new life. How does poverty and lack of resources really impact that? Maybe Maya, I'll turn to you first.
Poverty plays a great deal in the type of health outcomes that you see in communities of color. It's not that people in these communities are intentionally not taking care of their health. It's just that they don't have access to the resources. And it was systematically designed to be that way. So when you look in a lot of these neighborhoods, you will not find access to fresh grocery stores with fresh fruits and vegetables. They're typically like a third tier store that's selling food that is close to being expired, high in fats and sugar and salt, which is really bad for folks. The accessibility and mobility to just get around, for many folks, bus access is the only way to get to a doctor's appointment. And buses are not necessarily designed to be accessible. They're not accessible for families. They're not accessible for people with disabilities. And when you have multiple children, it then becomes even more complicated. But also just thinking about the living conditions of a lot of the communities that folks are in, they were not designed in a way that was intentional to be environmentally friendly for people's health. So a lot of children who are born in these communities, you will later find out they have high exposure to lead. A lot of them will be exposed to asthma at an early age, and this can kind of create long-term chronic health effects.
No, I think that's so important, right? And you said some key things there: systematic underserved resources in communities, right? We're not just talking about access to healthcare. We're talking about access to healthy foods. We're talking about access to childcare. I'm hearing transportation, right? This is a systemic issue that is brought on by something bigger and larger than just not having the ability to get to a doctor's appointment, right? It's really about how do we begin to change systems and not just change through programming. Michelle, I would love to hear your perspective, especially for the work that you do at Diaper Bank of NC and doing a lot of work in providing resources to people in communities. You're on mute, my dear.
Oh, I promised myself I wouldn't do that. We hear from mothers every day, or expecting mothers, that realize suddenly the price of diapers, and they're frantically trying to figure out what they're going to do once their child is born. Mm-hmm. And thankfully in Durham and the Triangle, we're able to give them resources of where they can go every single month, but that's not the case across the state. And also it is difficult for them at times to get to those resources. So it's a struggle every day. We've done a lot of work with Duke Pre-Maternity Clinic, And we see a lot of times how, especially hourly workers, mothers that are expecting, they'll cut their hours or they won't schedule them. And then they're not, the stress and anxiety that goes along with that when they're expecting and trying to save up for their child to be born or make a doctor's appointment, it weighs on them and it's very difficult. And so I think what we need to do is really tackle these systematic problems that we see in our community that's affecting birthing mothers.
Absolutely, absolutely. I totally agree. And something that was really staggering to me in my preparation for this conversation and really just being so passionate about maternal health altogether, according to Blue Cross Blue Shield of North Carolina, Black birthing people are 3 or 4 times more likely to die during childbirth. And that to me was very daunting. 1, I'm a Black woman, right? 2, I have sisters, I have cousins, nieces, I have a mother, right, who have all given birth. And to know that even in this day, the risk of them giving birth is higher than other places was scary, right? Maya, I would love to talk about your organization and the work at MAAME and your focus on the pregnancy experience of mothers before, during, and after birth, and why you felt it was important to begin to advocate for the birthing experience, particularly for Black mothers and Indigenous mothers.
Thank you. Thank y'all for the opportunity. MAAME is similar to Joy, a young organization. It started from just personal experience for myself. With my first child, I was neglected during the birthing experience and dealt with extreme hemorrhaging with my first pregnancy. But then also graduating college in the middle of the recession, you know, trying to navigate a very complex situation and being educated, you know, understanding how difficult for a person, an able person, to kind of navigate all of these systems. I could only imagine what it was for someone who didn't have the education or the resources to really just kind of figure this stuff out. And it just seemed like every corner that I was trying to get help from, there was always a door closed and not necessarily someone or an entity to be there for support. And so through that, I went online. I found tons of online communities with Black and Brown women who were like, hey, there aren't any spaces in our community. And this is conversations that are happening across the state, where they just didn't feel like they were being heard, that their providers were ignoring them, that the government systems that were set up to provide support only looked at them as a number or less than, and so they were receiving inadequate care. And because of that, they were dealing with chronic diseases. There were incidences where some mothers needed help with mental health, and instead of them getting help, their children were being taken away without any type of foundation or backup support to ensure that these families didn't fall through the cracks. And that's how MAAME was formed. So our goal is that we focus on birth justice. We want to make sure that birth and reproductive justice is a #1 priority, that women birthing people have access to accessible healthcare and to doulas if they need it, but also so that way they can advocate for their bodies in a way that is up to them and not by us, not by a system, not by individuals, but everyone should have free will to decide what they want to do with their bodies. We also focus on environmental justice because it's the living conditions in which our families have to then take their babies back home to. So we want to make sure that these families are aware of any type of contaminants in their home, any long-term effects of the water that they're drinking, the air that they're breathing. And so we also want to make sure that through that, they also have healthy access to food. So we provide emergency food boxes to families and work with tons of community networks across the Triangle area to provide food to our families as they need it. And then we also focus on economic justice. One, we want to make sure that people have that supplemental funds if they need a light bill paid, if they need baby essential items, that those things can be covered. But we're also looking at job training. The work as a birth worker, particularly as a community-based birth worker, a lot of times is unpaid. We are working with families within the communities that we serve to train them to get into this field. And a lot of times it has costs such as childcare, parking, food. You're being with a family for almost 30-something hours. And to be honest, it's still a new field that is unpaid. And a lot of times the systems that are bringing us in don't realize the type of requirements that come with that, because they're dealing with their clients let's just say maybe 2 to 3 months, through the course of their pregnancy. We're literally with them from the beginning up until that child is 2 years of age. So we want to make sure that these families are successful economically. And let's say there are gaps where a birthing person is not able to go back to work easily because of health conditions. They can now pick up a new skill as a birth worker and do similar work to start their own businesses. So we're really trying to make sure that we meet everyone in every aspect of this journey. And it's so important because, like you said, Allison, the rates are high. The rates are high because of unconscious bias, but there's also intentional bias in this process because it was systematically designed to be this way. So for us, it's really important to make sure that we are building a network, not only in the Triangle, but statewide with other community-based doula agencies to ensure that as our clients migrate across the state, they have a community that they can call home.
Absolutely. And thank you, Maya. And you raised so many important points. And my mind was just thinking back to all of these sort of cultural references that we see in the news and in the media about birthing experiences and how they end in these traumatic ways. I think about when Serena Williams gave birth to her daughter, and she did a great expose about how she had to advocate for herself and her baby. And this is Serena Williams, the #1 athlete in the world, male or female, right? And she is having to advocate for herself, even giving birth, right? And then also thinking about, if we scale it even down further, thinking about in social media, right? There was a young TikTok person who went viral because she talked about having a post-birth doula in her home to come in and help her as she was transitioning, and people not even knowing that that was an option, right? I think there's so many systemic barriers that are in place that even when we talk about access to information, there's so many things that people don't know. But as you most eloquently said, the system was not designed, right, to support these people. It was not designed to include us. And so we can't go searching for things if they weren't even supposed to be there, right? But we have to create the communities that we want to see and create the opportunities for women to give birth healthily, right? Thank you for that response, Maya. When we know that when mothers leave the hospital, as you mentioned, continued support in that transition is vital, right? Joy mentioned it earlier, a lot of isolation can occur through the pregnancy experience and then post-pregnancy. And mothers experiencing poverty don't always have access to those crucial items, right? That are necessary for them and for baby. And I think it's important that we begin to note that a woman's health, even post-giving birth, is still crucial, right? Even after she's given birth to that baby, she's still got to get acclimated to her new experience. It's a transformative time. And so support and access to resources, as we've mentioned, is so key. According to statistics, Black, American Indian, and Hispanic babies are up to 2.5 times more likely to die in their first year. Now, I don't know about my audience or anyone else here, but anytime I hear about a baby dying who doesn't have to, that's going to move me, right? That means that we as a community are not doing our job. And that means we need to figure out how we can begin to alleviate these gaps. Michelle, I would love for you to talk a little bit more about Diaper Bank of NC, the work that you all are doing locally and statewide, and how your organization is working to reduce not only these daunting statistics, right, but the barriers to resources for families across the Triangle in North Carolina.
So we provide diapers, period products, and adult incontinence to families living in poverty through organizations. We distribute diapers in the Triangle to about 2,000 babies a month. But what's key about our model is we distribute through organizations like MAAME, Equity for Birth, Welcome Baby, that is really experts at working with the families, building relationships, and identifying their needs. And then we are the experts at procuring diapers, warehousing, forklifts, pallets of diapers, getting all the different sizes that families will need and a child will need during their diapering years, and distributing them in an equitable way to our community partners. 1 in 3 families experience diaper need, and there's no assistance for diapers. And unless you are a mother that has a baby or a grandparent that's taking care of a child, you don't realize the cost of these items. And they're up to $100 a month, and they could be 16% of a low income person's monthly income, which is staggering if you think.
Michelle, I had to jump in real quick because last night ahead of this storm, my own mother, she said, can you run to Target and grab some diapers? I've never bought diapers a day in my life. I was astounded by the price. I said,
Shocking.
oh my God.
Shocking.
I said, these are high, right? So I just had the $27.99. I said, oh my God, this is crazy. I can't imagine.
Yes. And so we know that families are making choices between food and diapers, and every single time they would choose to feed their children and try to make those diapers last as long as they can. We also know that mothers will put their child first, right? So they will get the child food, and then they will get them diapers, and then they will do without. So we also do period products for mothers, postpartum supplies that they may need during that time. And so it's really important to know that the diaper bank really is a support system for amazing organizations across the triangle. Right. And they are the experts at doing this work and building the relationships and identifying the needs. And we're there to support them. And working together, we're able to serve so many families and identify their needs that way.
Absolutely. And I think, something that you've all said throughout this conversation so far is that this is not just a local issue. It's a statewide, it's a nationwide issue and conversation, and that is to be had, and really looking at how do we address these systemic barriers, right, that are in place. It's not just about, one thing versus the other. It's not about just having access to resources. It's also about education about why these resources are important. It's also about, alleviating those barriers through resources, naming specifically money, right? We have to fund these programs and these systems, right, to support families that are in need. And I think it is something that we need to continue to push. We need to continue to talk about on as many platforms as we can, and why we were so passionate about having this conversation over the week. The community at large has had the opportunity to really engage in stories about the work that you all are doing across the triangle and across the state, and really understanding that it's not just about, it's not just about diapers, although those are important, but it's about the whole person, right? And we know that sometimes in our nation, there is a strong debate and dialogue about reproductive health, about women's rights, about the rights of children and birthing people. And so I think that the more that we shed light on these conversations, we talk about these things, we begin to put dollars behind this work. I'm talking to the people in the audience who have the dollars, right? That's how we begin to change and advocate for these systems. As we begin to wrap up this part of the conversation today, ladies, I would love for you to share with me, if you could dream of what would a thriving maternal community consist of or look like? What would a community that really supports women, birthing people, what does that look like? And also, how can people currently support the work that you all are doing to make this dream come true? Maya, I'll move to you first, or Joy, I'll go to you first.
Sure. Maya, if you're ready, you can go ahead, because I'm still kind of dreaming.
It's okay. So for us, number one, it's important that people hear Black women, Black birthing people, brown birthing people, like just period, just listen to us when we say that we are going through these things, right? These are birth, pregnancy. It's just such a transformative experience to go through. And when there are barriers in place that prevent you from having a optimal birthing outcome, it is hard, it is tough. That alone, having to deal with those systemic issues alone on top of your body is stress. And that stress then induces disease while pregnant. And so the harder we make it for people to access these resources, the more we're going to see systemically the continuous of these negative health outcomes. I forgot the medical term for it, but there's this medical terminology which states that we as women, as birthing people, are in the wombs of our mothers and our grandmothers and great-great-grandmothers and so forth. So everything that they have dealt with generationally, our bodies are already impacting that. And now we're recreating that through the stress and structures there for the next generation. And so for us, it's really important that systems also listen. It is not that some of us want to be anti-system, but we also want to make sure that we create safe spaces for ourselves. And sometimes that means that, major health institutions or allies are not included in this space. It doesn't mean that we are anti other groups coming in, but we have not had the time, the space, and the resources to nurture and heal ourselves as a community. And that is so important if you want to see improved health outcomes. So for us with MAAME, we like to work with partners who like to work with us versus trying to tell us what to do. We believe in evidence-based information and material, which is why research from a community standpoint is really important, because Black and Brown people don't trust the system. So when you can't figure out why health outcomes aren't improving, or why people are anti-vax or uncomfortable with participating in certain research projects, it's because of the faces that designed it didn't have that representation or the intentions to support these people with improving health outcomes. And so for us long-term, we are looking to have a space for community. We are looking to create more access to better prenatal care, because unlike Durham, where it is a little bit more mobility to get access to prenatal care, in a lot of counties within the Triangle, it is not. If you're in Wake County, there are only a couple of providers that will take Medicaid. So you're talking about a county that has millions of people, and women have to travel to Wake Forest, downtown Raleigh for the health department. And then all of those rural towns on the outskirts of Wake County, those women and birthing people don't have the same right and access to a positive birthing experience. So we really want to make sure that we look at the policy. We really need support from you all in fighting policy to making sure that birthing people can have better outcomes, support for reimbursement for community-based doulas, because the work that we do, not only are we in the hospital, but we have to deal with the maternal mental health side of things. And the system right now hasn't quite figured out how to support these people. And now we as community-based workers are now trying to be the caretaker, the nurturer, the provider, to ensure that they have some type of community support behind them, so that way they don't get neglected and fall through the cracks. And there's a tons of things that I would say that we love and we need and support. I'm gonna let the other ladies tell y'all. But as of right now, the advocating policy changes is so crucial into the work that we're doing, because without that, we can only do so much on the ground. We can only do so much with every individual that comes through our door, but the policy has to change.
Absolutely, absolutely. Joy?
Yeah, plus and to everything that Maya just uplifted. When I dream of an improved maternal health care system, I see options. I see options to not only birth in a hospital setting, I see options to birth in home-based settings and women's care settings and birthing center settings, sweet baby girl. I see when we take advantage of those options, we walk in and we're able to choose folks that look like us and mirror our culture. When Black doctors care for Black babies, mortality rate for Black infants is cut in half. So it's very important that we are reflected in our healthcare system and that we have the opportunity to put our passion and take care of our own families. I see birthing folks who are educated and empowered and well-resourced to walk in and get the level, frequency, and quality of care that they want and that they imagine. And I'm also just seeing just a complete reallocation of funds for our healthcare system. We have the resources. We, in my opinion, don't use the resources in the right way. Our healthcare institutions have fancy security and offices and cafes and Starbucks on every floor, but they don't listen to their consumers, and they don't listen to their birthing folks, and we can't even get like a bottle of water sometimes and stuff like that. So I want to see a complete reallocation of funds, and the majority of those funds be sitting in new buckets, community-driven buckets. I want to see community leaders and folks with the experience of giving birth be at the table alongside medical providers, so that the wisdom I gained from living through it is valued at the same, if not higher level, as the wisdom that folks may have gained through a class or a book. And co-creating solutions, co-deciding where resources go, how programs are rolled out, how patients are cared, and how they are able to share their experiences and what we do with that feedback. I just see like a complete overhaul, all in power structure, so that when we walk in, it's just a whole new vibe.
Absolutely. I love it. I'm hearing safe spaces. I'm hearing trusting spaces. I'm hearing reallocation of funds. I'm hearing we just really need to restart this whole system, right? Build it from the ground up, because as you all mentioned earlier, the system was not created, right, to reflect the experiences and the people who reside in this country. Michelle.
Yeah, you're going to be sorry to say this. I think that our future, if I was to wave a magic wand, would be that we wouldn't have to have a diaper bank. It is disgusting in many ways that families have to struggle so hard for basic hygiene items. And through our research, we found that 78% of the families receive our services are working 1 to 3 jobs and still cannot afford the most basic needs. And there's a misconception about poverty in our community that I would also see flip, because there is a conception that the families receiving services aren't working hard enough, they don't care enough, they're not motivated enough. That is exactly the opposite of what we see. We see families that care deeply for their children, that work extremely hard and still cannot provide the most basic needs. I also would say that we need to, according to the state of North Carolina, hygiene items are designated as the same as household items, pots and pans. We need to value hygiene items for human beings. And there's just a lot of work that needs to be done. I saw Joy about being taxed. We have a luxury tax on period products. We actually spend more to have our period in North Carolina. And so there's just a lot of work around that we need to do with legislation, that we need to talk about in terms that dignity is not a privilege. And we should not have to be a color or a certain tax bracket to have the basic hygiene items that we all live with every single day. And so I imagine a world without diaper banks, quite frankly.
No, yes, I hear you, and I appreciate that. And I'm sitting with dignity is not a privilege, right?
Allison, can I add one thing?
Yes, absolutely.
I think it was in regards to Sari's comment in the chat. People forget that folks who need help have allergies and other conditions that don't make certain products suitable for their bodies or their food, which is why with MAAME, when we accept certain goods, we're very mindful of ingredients. We're going to be dealing with families who have babies that are coming from the NICU. So, preemie items are always something that becomes on demand when needed, but not something that's easily accessible, whether it be in the stores or online. Also, certain types of formula, even though we are in favor of breastfeeding, we understand that certain families and based on certain health conditions have to have formula. So when these families are on these specialty formulas, a lot of times government agencies don't meet the requirements to provide these resources to these families, let alone children who have severe food allergies. As someone who went through WIC with a child who had a peanut and tree nut allergy, milk allergy, like I could not use a lot of stuff that was on that list. I think it's changed now, but when I was early on starting out as a mother, like my household, we couldn't use any of the foods that were available on that list just because of those allergies. And I'm sorry, Joe, I'm gonna let you hop in because I can't see it, but just being very mindful that it's not, the resources that have been designed to be available aren't even equitable or really accessible if you're dealing with medical issues that they have not accounted for. And it's very expensive. I think for some of the families who have to have these specialty formulas, they're almost paying between $50 to $70 for a cup that's supposed to last them for a month. And a lot of times that's just not enough.
Absolutely. The chat is on fire here. Joy, if you don't mind, she shared, sometimes people don't realize public assistance doesn't allow for customization, right? So people who may have allergies or have certain special needs for their baby aren't able to receive assistance because the system is not set up to support them, right? And so I think that's important that we continue to raise that up, is that what we're talking about here is a real overhaul of the way we think about maternal health and what that means in our community, and how we begin to alleviate these barriers and create a system that, quite frankly, really honors women, right? And really honors the experience of birthing people. And I think the longer that we begin to negate these things, we are doing ourselves a disjustice as a community. I'm going to move to the Q&A because there's been some questions to come through that I want to honor and raise up, and I know you all have shared some responses. We got a question from Allison George. Do any of your organizations support abortion care and or access? She shared, it is such a critical element of maternal health care that politics have forced women to whisper about. And both Joy and Maya shared some awesome resources. There's the Carolina Abortion Fund, in addition to the Carolina, sister song, the Black Birthing Bill of Rights, right? And so there are resources that exist that can support, right, all components of reproductive health. I want to make that clear, right? Because all choices matter. And I think autonomy, yes, Joy, autonomy is such a huge, huge part of maternal health. Are there any, I see a question. The chat is on fire, y'all. I'm sorry, I'm getting a little distracted, but I love it because this is something that's so, so important, right? How many of us don't know someone who hasn't had a baby or will have a baby, right? We all have mothers. And so I think, it is so important to really begin to think about how we begin to break down these systems and how we begin to really create opportunities for mothers and birthing people to thrive. I've just appreciated this time. I really have appreciated this conversation. I have been fired up all week to be able to create and be in this space with you all to really talk about the importance of maternal health outcomes, how we can begin to advocate not only for your organizations, but for the thousands and millions of women and people who will either give birth or become parents, and that they deserve to have access to all the privileges and things as people, right? And I think that that is something that is crucial. I see a question coming through. How can people take an active role in supporting the organizations here today? Yes, that is a great question. How can people support you today and really beginning to change these systems? And I'll let anyone who's ready to go first there. How can we support you today? Michelle, would you like to go? How can we support you?
So during COVID, we've seen a 400% increase in diaper requests, an 800% increase in period products, and a 2,000% increase in adult incontinence supplies. And it is not slowed down. It is unsustainable in every way. And at the same time, we've seen donations go down in terms of product, because the groups that used to meet together aren't meeting together. So they're not doing drives, Boy Scout troops and Girl Scout troops. So we're at a point where we're buying more product than we have in the history of our organization just to meet the increased need. So a drive would be great. We have wrapping events. We collect diapers across hotspots in the community. So if you have diapers that your child has outgrown or you want to do a drive, that is a wonderful way of supporting our work that we do every single day.
Absolutely. And thank you, Michelle, for that note. I'm going to drop a plug here on this upcoming Monday. We will be hosting our rescheduled MLK Day of Service collection drive hosted by Diaper Bank of NC to directly support these 3 organizations here today. So if you want to take a first step, right? There it is, coming up this Monday. We will be on location from 10 a.m. to 2 p.m. You will be able to drop off items. Please feel free to check out the link in the chat for more information. But one tangible way, right, this upcoming week that you can begin to support this work. Joy, how can we support you?
Can I alley-oop? Michelle, you got like 2 questions. 1, are diapers taxed? And 2, do you guys get better prices? Is it better for folks to donate money to you or to buy diapers?
Oh, thank you, Joy. So yes, diapers are taxed, unfortunately. And we are able to purchase diapers much cheaper than you could ever buy in the store or online. We buy them by bulk, by the truckload, and pallets. So we are able to make that dollar spread a lot farther. I also want to do a quick plug because I appreciated what Maya said about different choices. And, you know, we also have a cloth diaper program for some families that can't afford that very expensive initial kind of package of cloth diapers that you need as your child grows. And so there's different ways that we're supporting families in that way. So if you have cloth diapers that you want to donate, that's another way of supporting our work. And we also distribute formula, the specialized formula that you talked about. It's not the complete answer, but I did want to mention that that's another way that we are supporting our programs that are doing the important work with the families that they serve.
Yeah, sorry, I thought that was important.
Thank you, Joy. Thank you. Oh, absolutely. You're why we're here.
So, so Equity Before Birth, there are tons of ways you can support us. One thing, like every ounce of support goes such a long way. So finding us on social media, every like, comment, share. Every time we, like Allison said, you're going to know, if you know a human, you know somebody that gave birth, right? So what we do resonates with everyone in some way, shape, or form, regardless of your relationship with the birthing people in your life. So just spreading the word goes such a long way. We have opportunities for you to volunteer. So if you visit our website and fill out our volunteer form, that goes a long way. We have some upcoming events in addition to the donation drive. We have some talks coming up and some panels, saving the date for Black Maternal Health Awareness Week in April, things like that. Like check our website, check our social media, and support the events that we have coming up if you can. Time is just as valuable as money. We always need man and woman power. And lastly, but not least, donate. We need resources. Our demand is through the roof, and we want to be able to have the capacity to meet that and then sustain what we have started. $5 a month, $10. If you're bankrolling 10,000, whatever, we'll take it and we would appreciate it.
Absolutely. Thank you, Joy. Maya?
Yes, same with everyone else. Please follow, like us on social media. It's the most affordable form of marketing that we can afford as small, organizations, and getting the word out about our resources and services. But we're always looking for volunteers. Like right now, we need a web manager because our website is having issues. And so I'm plugging in our volunteer form right now. We've been trying to get it fixed this week, and we just can't get it get it going. But we need volunteers to help us with our giving closet and to collect donations. We're still a volunteer staff, majority volunteer staff, thanks to United Way, with helping us a few years ago with getting our giving closet up. It's been sustainable, but now we need help with distributing these items to families. We need help sorting. Our giving closet has kind of reached capacity, and so we need to go through a whole little inventory sweep with everything. But we also need volunteers who are comfortable with being in the community and doing a lot of outreach work with us. That community health piece is such a big component of what we do, especially since COVID has begun, and it's the fastest way that we can get on the ground to reach people. And we're always going to be training and recruiting community doulas. To be a doula with our organization, you have to be a trusted member of the community. You have to be comfortable being, in different environments that are just not of your own background or culture. So we're really looking for people who want to give in a meaningful way without centering themselves in the work that they do, because the people that we serve come first. And also monetarily, as Joy and Michelle said, this work is not cheap. We're spending tons, I would say hundreds of hours with just one person, from the phone calls, the text messages, the prenatal visits, the appointments, the postpartum appointments when they go home. These things are not covered by Medicaid. And especially if you're a community-based doula, you're not doing a typical workflow with your clients when you kind of have like 3 appointments and maybe 1 postpartum, you go home. We're working with our families long-term. A lot of times they need help with financial assistance. They might need help with transportation. Our doulas need help with transportation to get to and from births, across the triangle. This past month, and also the end of December, I had 3 births back to back within 3 weeks, and in the snow. That is a lot. So we're out here being with these families, and a lot of times the hospitals aren't providing the resources for us to be there with the clients. So we have to bring these resources into ourselves. But our doulas also need support with childcare. So when you think about the type of financial support, the impact does really have 2 folds. You're helping our clients, but you're also helping the people that are volunteering their time who are in similar situations be able to give in a meaningful way to support those people and also sustain their lives to ensure that they're thriving after birth.
Absolutely. So what I'm hearing, audience, community out there, is your support is needed, right? Both your time, both your talent, both your treasure. That means your money, right? That means in order for us to begin to change these systems, we have to begin to put the resources and the dollars behind it to do so, right? What we are talking about and asking for is a shift from charitable approaches, right? We're talking about a justice-centered approach to maternal health and how we can begin to fill these gaps and begin to change the system. I just want to say a big thank you to our panelists today. I have been excited all week about this conversation and just being able to shed light on the awesome work that each of you do in leading your organizations and serving our communities. This has been a great way for us to close out Maternal Health Awareness Week here at the United Way. Thank you to our audience for joining us today. Please stay connected to these great organizations. I see they have shared their social media and website handles in the chat. We will also make sure that all of our audience today in our survey receive these handles. So please, we value your feedback. So take part in that. If you learned anything today, right, then we have done our job. And if you feel so inclined to move, then we've achieved exactly what we were supposed to do today. Please remember, right, that for thousands of years, women have given birth to children. This will continue, but how can we as a community begin to support and center those folks, right, who need us most? Thank you all for engaging in today's conversation. If you've learned anything or loved today's conversation, we'd love for you to join us for our second installment. Next month, we will be kicking off our 21-day Racial Equity Challenge. We are focusing on equity and leadership. How can we support women and women of color in positions of leadership, right? Such an important conversation to be had. Check out the links in the chat and on our website. We're going to drop those and make sure that you all have them. But I have just enjoyed this conversation. And again, remember, if we want to be the change, we have to start acting upon it.